Anyway, you know what? If you are concerned about your heart health, then you know what? You should be very concerned about one very important number, and it's called your cholesterol number. Well, guess what? It is Rally for Red Day, and Dr. Reza Arsanjani is a Mayo Clinic cardiologist, and he's here, well, to kind of help us understand, and I'm going to call it, Dr. Arsanjani, cholesterol 101, okay?
Sounds good.
Because cholesterol is one of those numbers that we all get. We all find out what that level is.
Yes.
We do a basic blood test, right?
Yes, that's correct.
But I don't even, what exactly is cholesterol?
So cholesterol is, it's a component that we actually use for creating cell wall, but then there's a good component, there's a bad component. So the bad cholesterol is your LDL, and that leads up to cholesterol buildup or plaque buildup in the walls of your arteries. The good cholesterol is your HDL, that's which absorbs the cholesterol and carries it away into the liver. And triglycerides is another component which is the fat that we use as energy.
Okay, are triglycerides good for you or bad for you?
Studies haven't been shown to be as bad as your bad cholesterol. However, if the numbers are significantly elevated, they can have other health risks associated with it, including pancreatitis and other diseases associated with it.
Okay, let's talk about those numbers then. What would be a good level? And
Sure.
I know that's tough for you,
Yes.
because it depends on a lot of different factors.
Absolutely.
But is there a baseline? That's
Yeah, generally we would say that we want your bad cholesterol to be less than 100, your good cholesterol to be above 60, and your triglycerides to be less than 150.
So that's kind of strange. Do you want the good number to be higher?
Yes, because again, that's the cholesterol that kind of takes the bad cholesterol away, and kind of if your good cholesterol is high, you're less likely to get plaque buildup in the walls of the arteries.
Ah, okay. And you have a little example
Yes.
here of an artery, and this is if you could just hold that real still, guys. I want to show you. This is just a classic example of the bad versus the good,
Yes.
right? And look at the small opening on that side there.
Yeah.
That's the reason why people have a heart attack.
Exactly. And the thing is that this is a normal artery on my right hand, and the cholesterol built up. And this what happens is that the cholesterol builds up in the walls and causes a narrowing of the lumen or the opening, and this can actually cause chest pain, heart attack, strokes. So this is what we want to prevent, and this is what we need to know the numbers.
And that number, or I should say that much of blockage, that's significant. That's
Absolutely.
over time, right?
That's over time.
Okay, let's talk about prevention then.
Sure.
You go in, you find your number out.
Yes.
Okay, let's say it's not a good number.
Yes.
It's a bit high.
Yes.
Medication isn't always the best way to go, you say?
No, I would say initially, again, depending on how high the number is. Again, if it's mildly elevated or moderately elevated, lifestyle modification, regardless, is always the first step.
Okay.
We want to get on a good diet, exercise, eat healthier, and potentially by doing that, you can actually drive down your cholesterol by 20%.
Wow.
So again, you can go from a bad number to a relatively normal number with lifestyle modifications.
Okay, and then you say there always is that possibility, even with those modifications, you could go in and still your numbers will be high.
Yes.
Then what?
Then we're going to have a discussion, and we say, okay, these are options available. These are medications that are available. We will go over the side effect of these medications, and if it makes sense, and again, depending on what your 10-year risk factor is, we say, okay, I really highly recommend this, or let's try this for another 3 months. And again, let's try the lifestyle. If we don't get where we need to go, then we potentially can start the medications.
Okay, have a plan,
Yes,
right? The bottom
absolutely.
line.
Yes.
Dr. Arsanjani, thank you so much. Really, really good information. Once again, the importance of knowing your numbers. And for more information about heart disease or to schedule an appointment with the Mayo Clinic cardiologist to find out what your numbers are, here's the number for you to call, 480-301-8200. And you can always learn more at mayoclinic.org. And of course, we don't want you to forget ABC. You know what? We team up with Mayo Clinic every month right here on the 15th. It's our Rally for Red campaign. Each and every month, we're going to send you easy to follow recipes and ideas to help keep you and your loved ones heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred.